Dr. Herbert Navasa, who's the Commissioner, Health Services, Environmental Health, and this is under the Ministry of Health. And then we also do have Ms. Brenda Achiro, the Country Director, Water for People, Uganda. Later on, expectedly, we'll be joined by Dr. Diana Twiner, the Permanent Secretary to the Ministry of Health, to be part of this discourse. I am Priscilla Regina Naloga, and of course you can follow up on these conversations. Your comments, your views, your opinions, your suggestions, and also some questions are most welcome on this program using the hashtag Clean Living for All. Now, of course, this is brought to you by the Ministry of Health with support from the Sanitation and Hygiene Fund, as well as Water for People. You are most welcome. Now, allow me to turn to my guests and give them the salutations for the day, then we can get on with the matters for discussion. We do have Dr. Navasa. Good afternoon.
Good afternoon, Priscilla.
It's a pleasure to have you.
Pleasure too.
Salutations to our audience.
Yes. Good afternoon, viewers, probably listeners. Like Priscilla, you put it, we are speaking about a very crucial topic, which is sanitation and hygiene, largely to underscore the importance of public health. Maybe to put it into a context, many people probably hear sanitation and they don't understand what it means. It means really having access to facilities that promote proper waste management.
All right, we'll get into the details of that. Allow me to first introduce Ms. Brenda Achiro equally. Salutations to the audience.
Thank you, Priscilla. My name is Brenda Achiro and I'm excited to be here today. Greetings to all viewers today, and thank you for tuning in. And as we delve into having interesting conversations on sanitation and hygiene, a long forgotten topic.
Okay. All right. Commissioner Dr. Navasa, in regards to sanitation and hygiene, what exactly are these in breakdown context?
So thank you, Priscilla, once again. So to contextualize the principle of sanitation and hygiene, for people out there, probably they may not understand what these literally mean for a common person. So sanitation means, for instance, having access to facilities that allow proper management of waste. And it doesn't stop at access, but how you utilize these facilities. And when we talk about waste management, it is a whole of approach, ranging from waste management, general waste management, but also the human waste, which is largely referred to as the fecal matter, and also extending to even water, wastewater, the way it's disposed off into the environment. So the ability to access the facilities, but also the conditions, the hygienic conditions around these facilities in a way that they are more healthier for sustainable living. Okay,
yes. Let's talk about the coverage of sanitation and hygiene for us in Uganda over the course of time, especially post-COVID-19. Yes. We had the outbreak of diseases like Ebola, cholera was amongst those. Yes. And so when we look at the coverage right now, where do we stand?
The coverage has been improving over time. But it's not yet very good to be proud about. And I think to talk about sanitation, for instance, it's also broken down into a number of levels. There's when you have completely lack of, so that's called zero access to sanitation services. We have limited, but I think in the context of Uganda, we are trying to look at basic sanitation, but the most desired level would be advanced level of sanitation, where you have all desired level of sanitation services. So in terms of sanitation, basic sanitation coverage, we are standing at 48 for urban areas and around 24, rather 48 for rural areas and 24 for, did I put it the other way around?
Yes, it's yes. 48 for the urban and then
24 for the rural areas. And in terms of hand hygiene, we are standing at 56 for the 53 for the urban and 36 for the rural areas. Okay. When you look at healthcare facilities, the facilities where we offer health services, we are not doing well in terms of basic sanitation. We are less than 5%. And in terms of hand hygiene, again, it is less than 50%, roughly about 46%. So the coverage is not that good to be proud about.
Okay, all right. We do have civil society, people, Water for People, on ground to literally see these experiences hands-on. And so I will have Madam Brenda Achiro coming in here. What's your experience on ground? What do you see have actually been the contributors to the poor hygiene and sanitation for Ugandans, both in the urban areas and the rural areas?
Well, starting off with the problem in the rural areas, it's mainly because people do not prioritize sanitation and hygiene. When you look at the long list of what people need to look at household level, sanitation and hygiene comes at the bottom of the list. And that's one of the big reasons. The other issue is people should accept to pay for a service. You need to love your sanitation facility enough to put money into it and get one that is improved. So when you look at the different priorities that people have, sanitation and hygiene comes at the bottom of it. So that's one big problem, and that's why, I mean, there are more difficult situations where you find people getting into the open, which is totally unacceptable. Then in the urban areas, the problem is really the poor management of fecal sludge and solid waste, because in the urban areas you have very many people congregating, you have many unplanned settlements.
Yeah, but then in the same urban areas is where there's a lot of, development to cater to those. You have public toilets that are, being put up left, right, and center. You do have homes and, places of residency that are catering to that. Right now, of course, as far as KCC is concerned, there's a policy. You cannot put up a structure unless you first put up, a disposition place. So how is that possible?
There's a percentage that live in unplanned settlements, and it's a characteristic in every urban place. You will find unplanned settlements, and those are the main places where you find the fecal sludge poorly managed, solid waste poorly managed. I'll give an example. You find that with all the plastics that we have around, the channels are clogged, and then you know what the ripple effect is. A bit of flooding because the water can't flow, but then also there's a lot of draining fecal sludge into the drains. So that is characteristic in unplanned places, or slums, if I may call it.
Okay, let's talk about the advanced element as far as healthcare facilities are concerned to cater to the results or repercussions of poor sanitation and hygiene. Are those good right now, or what's the status from your point of view?
Well, doctor might add to that, but I'll give my opinion. Of course, the healthcare facilities, there's a little bit of more control with the management that are in place, but they are also affected to a great extent. If you're not having very good management of the medical waste in place, then there's opportunistic infections that people get. You go to a healthcare facility to get treated only to pick up an infection. So it is not as bad as it is in the household level, because it is an institution that has quite a number of management structures to control.
Okay, all right. When it comes to the element of the aftercare, sanitation, hygiene being poor, then people have to turn to the health centers. Doctor, from your perspective and where you stand as the Ministry of Health, how challenging has that been to bridge the gap between good sanitation and hygiene, as well as a healthy livelihood and a healthy community?
Yes, thank you, Priscilla. First of all, there's a very thin line between the two areas, having the proper sanitation and also having good health, because there is not even an amount that is acceptable to say that this is a very good form of sanitation, however good levels you have. Even when you have 99%, that 1% could actually accelerate the challenges of public health. You look, for instance, when you have a hospital that has not managed the medical waste, just one syringe poorly disposed of could accelerate infection, and then you end up creating what we call hospital-acquired infections. And so it means that the desired level would be when you have total sanitation, total hygiene in a hospital, or even at a household level. So it is important that if it were possible to observe total good environment at an institutional level, but also at all levels, be it personal or home environment. You look, for instance, when you have a mother who has delivered in a hospital, and they have to breastfeed, but they don't have access to safe water. They have to touch a breast with poor hands, so really contaminated hands, and the child has to breastfeed and pick an infection. So you end up transmitting infection to a newborn. And also looking at somebody who probably requires just enough water to manage the environment where they have been admitted. And so limited access, or even lack of enough access to water or hygiene environment around you creates a very huge public health concern.
Okay, all right. Because in my picture, I'm picturing, a health center 3 or 4.
Yes.
It's already overpopulated. That alone is a sanitation and hygiene problem, and then the facilities in which they have to, use are not that clean on a daily basis. And then, of course, you do have the collection centers for the other forms of waste that you mentioned, the fiscal waste amongst others, and then the water environment around these places. It's all something that needs to be considered. All that being put into perspective, Commissioner, then it begs the question, what are the most pressing challenges that the ministry is facing in advocating for good sanitation and hygiene?
First of all, to contextualize it, the challenges are really too many. But I think the most important challenges look around, first of all, a neighboring environment. So that neighboring environment looks at the policies that we have and the enforcement of these policies. And I think it is important for our viewers to note that in order to have a complete hygienic place or complete good sanitation or safe place, you've got to deploy both a carrot and a stick.
Okay.
And in terms of a carrot, I think the ministry has been doing all we can together with our development partners to ensure that people are aware. And so we see some of these practices still continuing, either indiscriminately or maybe when people really errantly don't choose to omit what we teach them about.
Okay.
So it is important to deploy a carrot at a point where you think probably engagement has failed to work. For instance, why should somebody continue to do open defecation when they know that actually they could do an alternative better part of it? So I think as a ministry, we are looking at how a neighboring environment can be enhanced through proper enforcement, but of course as we continue to engage. Yes.
Okay, speaking of engagement, development partner, Water for People, Madam Achiro, in that regard, there's always a gap that is being filled by civil society, private sector to aid government in, providing the very best of basic services to its citizenry. And therefore, on your side, what is that particular gap that you have been focusing on to help government with?
So the gap has been around strengthening the system, we should say. First of all, we must acknowledge that government has set up systems that ideally should work perfectly well. There are just a few things that need to be strengthened along the way. So Water for People, together with other development partners that come in to complement the efforts of government, are now aiming at system strengthening. For example, if we are having investments in sanitation and hygiene, we are trying to see that we do not implement them outside the structures of government. Why? We need these things to be sustained. Development partners come and go, but government will always be there. So that's one thing that we are doing as development partners, working through the structures of government. In the process, the system is strengthened, knowledge is kept in, so that when we phase out, the structures of government that remain can sustain the investment.
What mechanisms of strength have you deployed so far?
Yeah, one, of course, is mentioned a little bit of capacity building that we do over the district local governments, for example, but also we do a lot of information sharing. We do a lot of producing IEC materials that we not only give the communities, but they're also kept at the district to continue doing the same. But also we are encouraging joint planning and budgeting, that we declare the resources that we have. For example, at district level, we plan together with the district so that our resources are reflected in the district development plans. So looking at the entire chain, from planning to implementation to monitoring, doing it together with government, and by so doing, the system is being strengthened and will be able to sustain investment.
All right, that's interesting. So there's adoption and adaptability. How have those two married, especially in something that you mentioned earlier? You did say that people find it difficult paying for some of these things to enjoy the good sanitation and hygiene. So how have people adopted to some of these mechanisms?
Yes, first and foremost, for this particular grant that we are managing, we are talking about market-based sanitation systems, which means there is an element of paying for the service. So first of all, you need to let the people know that they are not necessarily paying for a product, but you're paying for a service. So with this one, the product, which is a toilet, is theirs, but you need to pay the pit digger, you need to pay the mason or artisan who is going to put it up, and of course you need to buy the material. So with the improvement of toilets that we are talking about, we want toilets that will be able to be sustainable, to withstand shocks of the environment in case there are floods or anything. So that comes at a cost. You need a strong, climate resilient, if I may call it, product, which is a sanitation toilet. So it takes engaging them and first of all letting them know you need a good toilet, so you need to put a bit of money into having something that is sustainable. So I mean, it doesn't come easy. Many of them want to go for the cheaper one, but when the rains come, it's washed away. So you just keep putting it there, letting them know you have to pay for the service. The progress is slow, but we shall get there. Moving people away from thinking it should be, it's cheap, or I don't have to put money to it, I can do it on my own, and you move them towards having one that is improved, that is climate resilient, and letting them know the cost is put in a bit of money for a good service.
Okay.
Yeah.
Commissioner Dr. Navasa, why are we as a country failing on this campaign of good hygiene and sanitation?
Yes, Priscilla, we actually not failing. It's just work in progress. And of course, even a journey of 1,000 miles begins with a step. You have looked at the statistics. These statistics you heard about, for instance, the current status of 48 and 24. A few years ago, we are really doing very badly off. And I think with time, we've seen some improvement. So I should say we have not failed, but I think it requires a lot of continuous effort.
So you've mentioned the word improvement. What particular, for example, systems have you set up, or policies have been adjusted, or mechanisms have you adopted to move us to a better percentage as we speak today?
Yes, so when you look at sanitation and hygiene, for instance, these are huge, broad areas in a way that they're very cross-cutting in nature, and they involve individual responsibility. You will not have one government wake up one day to say we are deploying toilets for every individual in the whole country and have the coverage. So that's why it has to be work in progress. So the strategies that the government has put up in place is first of all to create demand for people to understand the need to invest in this intervention service. First of all, to understand the context of their health, how important their health is key, and so that they are able to invest on their own. So what government has been doing is first of all to accelerate demand. And I think working with the development partners like Water for People, we've been promoting what we call market-based approach. This approach looks at engaging the community so that we first of all help them to understand the need to invest. Why should somebody spend money in a hospital when actually they can control diarrheal diseases? The act of hand washing, for instance, is very cheap. Not only cheap, but it can even be almost for free. But by not washing your hands, you end up contracting diarrheal disease. And so the cost of treating that is so huge. The cost of suffering malaria by not clearing the bush around your home, it is just enormous. So I think what we've been doing is to engage people to accelerate and create demand so that they are able to invest on their own as government puts in the little money that we can. But also we have been looking at getting the private sector on board. I think Brenda alluded to it. The private sector engagement is very key, because when you look at sanitation products, for instance, they've got to be part of the value chain things that the private sector trades in. When you look at the SATO pans, when you look at these sanitation infrastructure, there's no way you can leave out the private sector involvement. And so government has to come in to incentivize the private sector, either by way of subsidy or creating an enabling environment so that they are encouraged to invest in that space. We've recently conducted a study called the Sanitation Economy, and that study indicated that there's a huge amount of money in the sanitation space, meaning we have a business that is not yet fully tapped into. And so what I think government is doing is to open the eyes of the private sector to be able to understand that that's part of the other business opportunities that are available. And I think what now we are moving to is engaging the policymakers to be able to see the role of incentivizing the private sector. Many of our health infrastructure, for instance, the medical equipment and others actually are incentivized. They attract subsidies. Even no tax, some of them don't attract tax.
Okay.
So why would somebody, for instance, why should government tax these cesspool emptiers, the transportation equipment, the process of managing the fecal sludge, all that actually can be incentivized, so that we see more business coming into that space. And in that, once you subsidize the private sector, then you're able to attract more business, and then you subsidize the cost of doing business, and you see more services. So we can now raise the coverage of sanitation from the current level of 48 basic up to probably 90%.
Dr. Nabasa, your recommendation is good, but it's long term.
Yes.
Until it becomes a reality, we still have a gap to deal with. I believe the other way it can be managed is on a national level, perhaps budgeting-wise through the Ministry of Health. Because why bring that in? Because the burden is still going to come back on government, you know, through the medical facilities. You're going to have a lot of medication and maybe human resource to cater to the disease burden that we started with earlier. And therefore, on the side of budgeting on a national level, how are we standing?
No, but budgeting, we really still have a very limited budget for sanitation and hygiene, and it cuts across all the ministries, departments and agencies. I know that of course it is worse when it comes to sanitation. Our budget for sanitation is this small. We will continue to engage government to see how they can better up that finance. Like I said, even money alone from government cannot sort out our challenge of sanitation and hygiene. So we continue to create demand, and like I think Brenda said, when you look at the value chain actors who are in that sanitation space, once you actually create an enabling environment and improve demand creation, even the home itself will be able to invest cheaply. We've seen people who were previously investing probably $1 million in constructing a toilet are now able to invest less than 300,000. Why? Because of trying to create an enabling environment. The entire value chain space. You see, for instance, part of the space includes the supermarkets who are selling some of these products, the hardware shops. Previously, somebody could not buy, let's say, a bag of cement. Probably they couldn't afford it, but by engaging the private sector, somebody can, you know, divide a bag of cement into probably a number of portions, so that somebody can buy that small portion of cement, let's say in kilograms, to be able to cement their floor of their toilet, so they can have a washable floor. Okay. So and also training the manson that she mentioned, so that you have the labor force within the immediate environment where the communities live, rather than trying to get somebody from a different district, and then it becomes very costly.
It is a chain of enforcement, that is true. So, Madam Achiro, in that regard, how has the chain of enforcement and implementation responded to you as a development partner in enabling government to be able to achieve its goals of good sanitation and hygiene?
Yeah, first of all, as a development partner or as an NGO, enforcement is the last option we would go for. First of all, as an NGO, we don't have the mandate for that. So it is the last option after all other things have failed. Okay. But certainly the push from government, I call it a push, creates a bit of it creates a bit of demand. And so the way NGOs have positioned themselves is strengthening the supply side, because it's three pillars that you look at: the demand side, supply side, and an enabling environment. Now government has been very helpful with having an enabling environment. We have the laws, the guidelines in place, and then through their mechanisms of enforcement, one of them, they create that push, that demand. So we've strengthened the supply side, making private sector, first of all, interested in sanitation and hygiene. Every private sector wants to first smell the money. And now here we are presenting sanitation that everybody thinks, maybe not. And we are telling them, come, just come a little closer. There is some money there. You know, however little it can be. So that's how we've positioned ourselves, and maximize the enforcement or the push that comes from government. Otherwise, as partners, we don't have a mandate for that. But I just wanted to add on the issue of the financing. Yes, government will put in a bit of money, but you know, resources are limited. But I do know a couple of organizations or development partners who have stepped into the space of sanitation financing. they have presented this as a product to banks. A number of banks, I know of Opportunity Bank, Centenary, Post Bank, that within their portfolio or within their products, they actually have water, sanitation and hygiene. So those are some of the innovations that is called for financing to, just unblock some of those blockages.
Okay. Yeah. Dr. Nabasa, this discussion is themed sanitation and hygiene for all. Yes. We're talking about the 46+ billion Ugandans that do exist currently. And so you talked about the enabling environment, one of those being in terms of policies. And therefore, what from the ministry's perspective should be the revisions to policies and reforms that are necessary to have this on a national level, on a national scale?
Thank you, Priscilla. So in terms of the neighboring environment, first of all, you need to learn or know that we have a new law, the Public Health Act, which just came into force last year. This has been revised, taking care of the emerging circumstances or scenarios, and I think it has better terms in terms of refocusing our agenda for sanitation and hygiene, among other public health interventions. So this new law, to be implemented fully, has got to have what we call the subsidiary legislations, the revision of those regulations and standards that make it possible to be implemented. So we are looking at that so that we have people-centered pieces of legislation and standards that will help us to be able to enforce. But not only enforce, but also be user-friendly for those enforcing them. But also on another level, sanitation lacked a standard-on policy. And like I said earlier, it is a cross-cutting mandate where you have, for instance, education handling the school sanitation. You have Ministry of Water in charge of components of sanitation and access to safe water. You have Ministry of Health handling community sanitation, institutional sanitation. So we did not have a standalone policy on sanitation. And I think what government is doing is to develop a separate policy on sanitation that is not only going to help the ministries in charge, but also to bring the development partners on board. Because like you need to note, the wash space, the sanitation and hygiene space is so big that you have hundreds of partners actually on board. And so to be able to coordinate them better, you have a national policy that actually puts them in one mandate. And I think that's what we are working on. In a few months' time, we should have actually a policy on sanitation, standalone, but it's going to be a sector policy that organizes the entire ministries and the development partners, and also putting the communities at the center actually of the whole policy, so that we are able to implement it fully.
Okay, Madam Achiro, in that aspect, let's look at the impacts because we have to be realistic. There are some impacts there. One on the population health as well as on the economic social development of our country. What is the impact of the poor hygiene and sanitation, or the statistics as they stand right now?
Well, one of the impacts that everybody can see is the fact that, bring it down to the local level, a household has to spend more money for treatment. If you have poor sanitation and hygiene, you'll often fall sick. You'll catch diarrhea. You mentioned diarrhea. We have COVID. We talked about COVID. COVID was really hygiene, because if you don't wash your hands, and then it easily gets transmitted. So it finally culminates in the fact that you have to spend more for medication. And I think for me that's that one liner that I'm happy to spell out critically, and eventually it will impinge on your finances. Okay. What would have been used for other productive use, you're using it for medication to get better.
Okay. Yeah. Poor sanitation does cost us a lot of money, about 389 billion Ugandan shillings on an annual basis, Dr. Nabasa. What other impact can we look at?
Other impacts?
Yeah.
You said it. First of all, one of the other impacts is causing catastrophic expenditures on the aftermath of poor sanitation. And you see these monies now would be potentially deployed to do other meaningful developments, like the roads, like the building hospitals, perhaps schools and others. But however, you continue to see government investing a lot of money into the response mechanism. And so Brenda mentioned some of the other diseases, but just to escalate them, if you look at malaria, for instance, many people may want to think that this is a disease that is outside the environment or sanitation, but actually it is a sanitation and an environment disease. Why? Because the breeding sites are the pits, the stagnant waters and the pits around the homes and the bushes that actually create the breeding sites for malaria. And so in the recent past we've had a lot of upsurge, malaria upsurge, and I think we declared it as an epidemic, and we've been treating it actually as an outbreak like COVID.
And we're expecting a vaccine towards the end of the year?
Yes, we're expecting a vaccine for malaria.
Okay.
But when you look and interrogate it further, actually you see that malaria is an environmental problem. Why? Because the larvae, and because of the climate change, we've seen the escalating numbers of mosquitoes. We see the larval source more than the sources are doubling. The larvae itself is doubling because of the climate changes and the temperature rises. So in order to mitigate malaria, you need to tackle the environment in which people live.
Right.
You need to tackle sanitation, because these garbage heaps are actually breeding sites for mosquitoes. You see, you have a lot of vector breeding in there, and so as a result you have a huge burden of malaria. She talked about diarrheal diseases, cholera. We've recently had a lot of outbreaks for cholera in Namayingo, in Kayunga here, recently in Bale. So many of these diseases which are associated with sanitation and hygiene, when they happen, they cause a lot of taxpayers' money to be invested in there, both at government level but also at an individual level. Somebody falling sick of malaria, of diarrhea and the related other diseases ends up spending more money into treatment. And this man actually, some other things are waiting for it. School fees is waiting for it. The food is waiting for it. So the impact is big in terms of the expenditure on it, but also the productivity. When you fall sick from many of these diseases, your level of productivity first of all goes down. But also when you look at education, for instance, the school dropouts as a result of poor sanitation. And when you look at sanitation, actually you extend it to also mean menstrual health. Children who don't have the menstrual products end up actually abandoning schools, especially girls. When you look at children who are engaged in fetching water in the morning before they embark to go into school, all these and mothers who are compromised because of trying to access water, the distant water sources. So when you contextualize this, it has huge implications on individual level, but also on government. And so it's such a complex situation that it's a socio-economic dimension when you want to understand the impacts resulting from the sanitation and hygiene.
Okay, let's talk about the impact in perspective of our young population, the children most especially. Some of these diseases have, reactions to them. They may cause stunted growth and malnutrition, amongst other things. And let's talk about the impact of these diseases when they're in communities to, communities' young population. Let me start with you, Madam Achiro.
Well, you rightly stated stuntedness, because I mean a child who is ever falling sick and ever going to hospital and all that, their growth is delayed or their growth is affected, so it leads to stuntedness. But I also believe their general development, even mentally, a child is not able to concentrate so much in school. So I think the entire well-being of a child is affected, both physically and emotionally and mentally is affected. So it has far-reaching effects, I believe.
Okay. Dr. Navasa, in that regard also.
Obviously, when you have children who are stunting, it has a long-lasting impression of the impact on their social construction. First of all, they will not achieve their desires in their lives. Many of them actually drop out of schools. If they don't drop out of schools, they are not going to achieve their full potential in terms of their maturity and development. And so eventually it does not only impact on them, but also it impacts on their families. Imagine, you can look at a mother who has invested a lot in their children, and eventually they do not get what they expect out of the children. So it has a long impact on them, but also on the state. If a state has a number of children that are not living out their potential, it means that they will also not have what they expect from these children. and productivity and all other factors are going to be largely affected.
Okay, you can be a part of this conversation. The hashtag across our social media platforms is clean living for all, and we're talking about hygiene as well as good sanitation for all, which is the embedment of our discussion. Ministry of Health and of course the development partner Water for People is with us in studios. We have this conversation. You can also stream across social media platforms on Facebook as well as YouTube. Just type in NTV Uganda so that you're not inconvenienced with the other things that you have to do, and yet still be a part of the conversation and add your voice to it. Now we want to take the direction of the interventions. Yes, we've had the challenges, but there's also challenges, I believe, do create opportunities, and therefore what windows of opportunity is government seeing and creating as interventions in order to embark on changing this narrative?
Thank you, Priscilla. First of all, as Minister of Health, working with our line ministries, Minister of Water, Minister of Education, our development partners here, Water for People, and a lot of other development partners, we set out to change the landscape for sanitation and hygiene and access to safe water. Why? Because we believe that's one magic bullet that we need to change the burden of disease. When you look at the previous outbreaks, for instance, COVID, Ebola, the one single hand method that we used to manage those outbreaks was largely hand washing. Just the act of hand washing. So we believe that it's high time to have the highest level of engagement with government. Government already appreciates, but what we are doing now is to engage further, for government to understand the need to flip the interventions. For instance, our expenditures on health, for instance, need to be reviewed. We need to review them so that we flip the expenditure. Currently, we have 80% into response. We'd like to see a scenario where 80% goes into prevention and 20% into response. Probably you're aware that 70% of the diseases, the burden of disease is preventable. That means that for every 100 people who go to a health facility or hospital, 75 of them are not supposed to be there. So the 25 who are supposed to be there are the results of maybe accidents and other unavoidable circumstances. So if government invested a lot in prevention, we would actually change the landscape of spending in health and save all that money into meaningful infrastructure. So we continue to high level engagement, and I think the highest level of engagement requires even bring the head of state on board, because I think he's a fountain of honor, and he has previously made statements that seem to be really encouraging prevention. When you look at the previous announcements, even the previous declarations that he has made, all point to a level of going into a level of prevention. When you look at our National Development Plan, Vision 2040, they all actually announce us into prevention. And so I think it is important to understand that as government at the highest level, we need to walk the talk. We need to prioritize prevention, and the only way you can prioritize prevention is by investing and prioritizing actions like hand hygiene, sanitation, access to safe water, so that you save the burden of disease.
Okay. So there's another intervention that is, within the Ministry of Health, and that is with the environmental health cadres.
Yes.
Let's talk about their performance enhancement.
Yes. So the cadres, like I said earlier, we look at both the government enabling environment, but also there is a structure. And I think, as many people know, in this country we have a decentralized system. So that decentralized system has a list of cadres, not only in environmental health, but across the other structures. But I think, let me speak to the issue of environmental health. We have actually structures up to the village level, ending with the VHT, who is the village health team. So these people have been put in place, and they are they're well structured. All the local governments have these people, and I think that what the Ministry of Health is doing now is to ensure that we improve performance through, first of all, developing them targets. These key performance targets are going to be, first of all, to make them understand what their expectations are, what government expects them to do. You will take, for instance, health inspection function, where you have abattoirs, you have the eating houses, you have these public places like markets, which are having nuisances, and yet you have the cadres just living right near those premises. Somebody works, their offices next to a market, but you have a lot of nuisances in the market where they don't even need transport. where they don't even need fuel to get up to next level of facility where they live and be able to cost compliance. So we've developed for them targets, and we believe that with these targets, they are going to enable us to measure their performance and put them to task. I know the other question will be resources. Do we have resources
I was going to go there.
be able to manage this? But we carefully structured these targets that they require very minimal resources. To the extent that because now with the development of many districts, coming up of many districts and continue to demarcate many districts, you see now the areas are very geographically small. Somebody manages almost a district which is formerly a sub-county. And this sub-county historically was managed by, you would have the district like covering, let's say currently 4 or 5 districts, which was managed by one person. But now that's equivalent to almost a sub-county. And so there's no reason why somebody cannot walk that entire sub-county with a bicycle or even walk around. So when you have somebody at Health Center 2 or Health Center 3, that's almost an equivalent to the sub-county. I think it is very easy to manage even with minimal resources. So by providing targets, we believe that working with them, we should be able to continue to check on their performance, regularly review this performance, and ensure that we understand the gaps to be able to, to provide support supervision.
Okay, all right. So resource mobilization is my next question.
Yes.
And financing it. I know that it's Madam Achiro. You did touch base on this and said that there are many NGOs that are now focused on hygiene and sanitation financing. Let's talk about new funding for sanitation and hygiene to Uganda.
Yeah, so we do have the Sanitation and Hygiene Fund, which is it's a catalytic fund, one that is we expect to unlock more financing. Like I said, you can never have enough resources. So this fund, it's a $5 million fund. It's catalytic in nature. We expect that at the end of the 3-year program, we should have been able to unlock a lot more.
And the 3 years beginning when?
We actually started last year in April.
Okay.
So it will run up to about December 2025.
All right.
Yeah, so it's run for over a year right now, and there is counterpart funding from government. So we have funding from SHF, which is about $5 million, but the government of Uganda, including the Ministry of Health and Ministry of Water, is providing counterpart funding of about $1.5 million. And it's going to focus both rural and some of the urban places or urban centers across 7 districts. So we are in Buikwe, Kayunga, Kamuli, Buyende, and then to the north we are in Kole, and then in the Midwestern we are in Kabarole. So about 7 districts, targeting both the rural and the urban areas. It's being implemented in a consortium. Like Dr. mentioned, all the 3 line ministries are involved: the Ministry of Health, Ministry of Water, and the Ministry of Education. Again, because sanitation cuts across, but the secretariat lies in the Ministry of Health. And of course there are implementing partners, including Water for People. We have IRC, International Water and Sanitation Center, Uganda Water and Sanitation NGO Network, and Finish Mandela. So it is a huge consortium, but again, the reason it has been designed that way is that we should be able to maximize potentials and strength and deliver this. It has a key element on innovation. Government may not have the space to innovate much, but the implementing partners are able to try out different options that we hope in the long run will be sustainable in the communities.
Okay, all right. We also do have the Sanitation Week. There's a Global Wash Forum that was held in Dakar, Senegal. That was back in 2004. And so, that meeting decided that annually between the 15th and the 21st of March, the week preceding will be World Water Day on the 22nd of March will be referred to as the Sanitation Week. So in Uganda, how are we going to be commemorating sanitation and hygiene through this week, Commissioner?
Thank you, Priscilla. So in line with that global requirement, so we've been actually celebrating the Sanitation Week for the past many years, since 2004. So this year our theme is sanitation for all, a key to sustainable living. We are hinging or attaching that to sustainable development. When you look at our sustainable development goal 6.2, it looks at sanitation for all, ensuring that nobody is left behind. So we are looking at that theme in the context of sustainable development, and we are launching actually the Sanitation Week on Thursday. We shall be launching it at the Ministry of Health. We have invited all our development partners and the key local government people to come, and we launch this Sanitation Week. The week starts normally from 15th to 21st. Of every March every year, and so this year we are going to launch it on 14th here at the Ministry of Health, and we shall commemorate it on 22nd in Kakumiro. We have selected Kakumiro given its bad indicators on sanitation and hygiene, and so partly we use that celebration to highlight the importance and help the area where we've celebrated this to be able to change.
All right, in closing, sanitation and hygiene for all are keys to sustainable, healthy living, and that is a discussion that we've had in depth. However, how do we conclude it, and what's the way forward? I'll give it to Dr. Nabasa.
Yes, so the context of sustainable development, like I said, we need to see that everybody actually gets involved. We don't have to leave anybody behind, because sustainable development has three pillars. It has society, it has economy, it has environment. And so to have a balance of ensure sustainable development, you must get people at the center of this whole conversation. That's why we're saying that we need to focus on people for sustainable living. We already talked about the impact thereof when you actually don't have the proper sanitation. So we believe by getting everybody involved using this theme, we are going to accelerate involvement of everybody to have a responsible citizenship. People who are actually very responsible at an individual level. And I talked about hygiene earlier, that hygiene is an individual responsibility. When you wake up in the morning, it's up to you to brush your teeth.
Yeah.
It is up to you to wash your body. It is up to you to have healthy food. It is up to you to have a very healthy kitchen. It is up to you to ensure that it's a complete human being. So if you do not do that, there's nobody who's going to enforce that around you.
All right. Thank you so much, Dr. Herbert Nabasa. He is the Commissioner and Environmental Health Services with the Ministry of Health. We've also been having this dialogue with the development partner, Water for People Uganda, Ms. Brenda Achiro, Country Director. Thank you so much for joining us. At the end of the day, it's individual responsibility start, and then it goes away to the nation or national level, coming down to help us. Hygiene and sanitation is practically 2/3 of your health, and so if you don't take care of the necessities, you're going to take care of the expenses to the repercussions of what you didn't take care of. So it all comes back down and zeroes down to you. It's your sole responsibility. Hashtag a clean environment for all, clean living for all. My name is Priscilla Regina Naloga. Thank you so much for having been a part of this discussion.